So here I'm going to illustrate using the Teishin to find points on the stomach channel. So this is a small Teishin that I get from AccuArtistry, and I found that the rounded end of it is very useful for finding points, particularly from the knee down and from the elbow down, in other words, the distal points. And so here's stomach 36 as we normally find it. If I use this Teishin, it can be very specific in terms of finding the most appropriate place, the deepest depression to treat. So here's a stomach 36, which is a stomach channel point, lower Teishin-point of the stomach. We can go closer to the stomach line, we get another point, and stomach 36 shows up very clearly there. It's a very quick way to find points. If we go down to stomach 37, which is a Shangji Xu, we're going to look for that point, and we go right into it. I'm changing the angle here just so the camera can do it. Normally I'm going to be perpendicular to the skin. And so that's the lower Teishin-point of the large intestine. If I keep going, I go right into stomach 39. Now they may vary a little bit from the textbook location, but I found that these points are very effective. So stomach 36, stomach 37, stomach 39, very easy to find in this manner. So now I'm going to find some points on the dorsum of the foot. Here's liver 3, and we're going to see that we come right into the point there. Sometimes it'll vary. If someone has a better point lower, then you might go into that one. But on her, liver 3 is right in this area. I'm going to do it with my left hand so that you can see it more clearly on the camera. I don't normally do this left-handed. Now in the stomach 43 area, if I come in with my normal hand, I'll come right into the point there, even with my left hand. It's pretty simple. It's right in there. You can overshoot it, which I did a little bit, but if you go gently, you can go right into the point. And here we have Mudo, Mulio, which in the next, between the third and fourth metatarsals, and that's a really good point to treat. Between the fourth and fifth metatarsals, of course, we have gallbladder 41, which we go right into there, and then gallbladder 42. And you can compare these points. Sometimes you'll find one is more tender. Of course, you can use this to elicit tenderness on the part of the patient. And then here's gallbladder 41. Gallbladder 41 really feels like a nice point for her today. So I would choose that point. So those are points in the dorsum of the foot. We can also do gallbladder 40. And up in gallbladder 40, it's a very deep point, so it's nice to come into this point. You can also use this for treatment, of course. It's a great acupressure tool. But if I'm finding gallbladder 40 on her, I just go right in there. And then, of course, I can needle it. I can take this away, and I can needle the point. Here's kidney 3. Kidney 3 is in the deepest depression in this area. So if we come in with our Teishin, we can go right into that deepest depression, and then we know exactly where to needle. Here's some points on the spleen channel, and we can do spleen 6. Normally we're going to find it there with our finger, and we can also really hone in on where the point is with the Teishin. Some people have a more active point at spleen 7, sometimes with edema, I've noticed, and she doesn't have it, but there's a little bit there. Spleen 9 is another good point to find. Sometimes on the larger points, I'll use a larger Teishin, and that can be useful for a depression that's a little bit larger. Now this is a silver Teishin, and it's quite a bit larger if we look at compared to the copper one. If we look at them next to each other, we can see the difference in size. And this is also a nice large round head for finding larger points, but it's too large for the foot. But this side, which is fairly rounded, is a really nice one for finding points in this area. We just did it with the copper smaller Teishin a minute ago, but for gallbladder 41, for example, this is a really ideal treatment and also a good tool for finding that point accurately. Or if we're getting in, see, it's a lot easier to get in between the metatarsals here, which can be a little jammed. So if I'm coming in this way, I can really reach, just because the size of the end of this silver indentation is really appropriate for this area. Here's stomach 43, when you come in like that, very easy to find. Liver 3 might be a little bit of a large point for this, but also works very, very well here. And then we can see, are there any other points along there that are good to treat? And I'm not really getting too much. I'm really just getting this one point on her. So on this one, I'm going to use the silver indentation, this point here and a little bit of the copper one to illustrate finding points on the hand. So in between the metacarpals now, like triple warmer 3, this is a great tool for finding and treating the point. If we come down here to the Yao Tong Dian, in this area and in this area, we can slide right into that, and it's a great treatment point. You can use 2 of them, of course, for treatment. And that's triple warmer 3. It's a little bit large for that point, but if I use the silver one, it's just perfect for getting into that point and any of the points along here. For large intestine 4 or anything along the second metacarpal microsystem, we can use this as well. So this is a really nice tool for that. Large intestine 3 or Dabai, and we have Lingu on this end, and we go right into Lingu point. Anywhere along here that we find, now large intestine 4 on her is going to be right there, and any other points that we find, we can explore and see what's sore. Another nice point we can do is going to be along 10. So we come over the bone here to the middle of this, along the shaft of the first metacarpal, and we come over, we can get onto lung 10 here, which is a great point for treatment. So here's finding lung 6 with the coppertation. So I'm going to come in here. You can see the general area is in here, and if I come along with the coppertation, I can really pinpoint exactly where I want to go along here for lung 6. Lung 6 is a larger area, and sometimes you'll find one, and then sometimes you'll find another point when you start to get into the lung 5 area. So this is kind of a upper lung 6, and this is kind of a lower lung 6. When you get into lung 5 itself, that's a really deep point anyway, so you could use it, but and that's fine. It's not absolutely necessary. Now, if you're doing Teishin work, and say you have your gold Teishin that you want to use for treatment, and you could use this copper for treatment, but say I was going in and I found a nice point on lung 7, then I can come in here with my gold Teishin, and then I can treat the point that way with my Oshide, and if I wanted to tonify the point, for example. So I can do that, and then when I'm done, I can cover the point.